How does internal fixation ORIF repair bone fractures? Imagine a broken bone that needs more than just a cast to heal properly. That's where a special surgical method called open reduction and internal fixation comes into play. This procedure is often performed by orthopedic surgeons to fix complex fractures that can't be treated with simple splints or casts. First, the surgeon makes an incision directly over the broken bone. This allows them to see the fracture clearly and carefully move the bone pieces back into their correct positions. This step is called open reduction because the surgeon opens the soft tissues to access the bone. Proper alignment is essential so the bone heals in the right shape and size. Once the bones are aligned, the surgeon uses tiny hardware to hold everything in place. This hardware can include screws, plates, pins, or rods. For example, screws are small metal fasteners that secure the bone fragments, while plates are flat pieces that cover the bone and are attached with screws. In some cases, long nails or rods are inserted into the hollow part of long bones like the thigh or arm bones. These devices keep the bones stable during the healing process. The hardware used in internal fixation can stay in the body permanently or be removed later if needed. The choice depends on the type of fracture and how well it heals. The entire surgery is usually done under general anesthesia, so the patient is asleep and feels no pain. After the hardware is in place, the surgeon closes the soft tissues and skin with stitches or staples. The limb might then be immobilized with a cast, splint, or brace to protect the repair and help healing. This method is especially useful for fractures that are displaced, meaning the broken pieces are out of their normal positions. It's also used when multiple fragments are involved, or when the fracture affects a joint. Sometimes, fractures that have healed improperly or not at all can be fixed with this surgery. The main benefits of open reduction and internal fixation include restoring the normal shape of the bone, providing strong stability, and reducing the risk of complications like malunion or non-union. It also allows for earlier movement and use of the limb compared to non-surgical treatments. From an orthopedic surgeon's perspective, this procedure is a precise way to repair complex fractures that cannot be managed with casting alone. It requires careful planning, often with imaging studies like X-rays or CT scans, to decide the best approach and hardware. After surgery, patients usually need pain management, regular checkups, and physical therapy to regain strength and function. In short, internal fixation with open reduction is a surgical process that involves exposing the fracture, realigning the bone, and securing it with hardware. This method helps ensure the bone heals correctly and quickly, restoring normal function and reducing future problems.